Can you make this diagnosis? A 38-year-old woman presents with a right-sided neck lump, heat intolerance, weight loss, palpitations, and labs that come back as this. So, where do we start? Step 1, always first look at your TSH, your thyroid stimulating hormone. Reminder that this is produced by the anterior pituitary in response to low thyroid hormone or production by the thyroid gland. And so in this case here, since TSH is low, we probably are in a hyperthyroid state, meaning our thyroid hormones are high, and we can confirm that in step 2 by looking at free T4 and T3, which in fact are elevated. So here we have overt thyrotoxicosis, hyperthyroid. Now, a common differential you might be thinking about with this hyperthyroid pattern is Graves' disease, which is why we order a TSI and TR autoantibodies, which here are negative, which we can rule out Graves, and then reminder that your TPO antibody is more specific for Hashimoto's, which is hypothyroidism. And so the next step is to order an RAIU, which is a radioactive iodine uptake study, and this will help us differentiate whether the nodule is producing hormones, if this is more of a leak like thyroiditis, or if this is exogenous use. And before we move on, because our inflammatory markers ESR and CRP are not elevated here, we're thinking less likely of subacute thyroiditis. And so this is what comes back, a focal hot area with background suppression. And so we're probably thinking a toxic adenoma. Now don't confuse this with patchy areas, multiple patchy areas of high uptake, which now you're thinking toxic multinodular goiter. And so for toxic adenoma, you're gonna want to treat the symptoms with beta blockers, where definitive therapy is going to be radioiodine ablation. Just for completion's sake, a normal to high thyroglobulin supports endogenous thyroid hormone production over exogenous, where you'd see a low thyroglobulin. Save this for your exams and see you next time.